Hello everyone, we are starting our series on gynecological oncology, and the first video in this series will be the basic knowledge about neoplasia. It's not just for gynecological but for all kind of neoplasia of the body. The second video will consider the general basic knowledge about gynecological neoplasias. There are basically four kind of neoplasia we discuss in gynecology, that is endometrial cancer, ovarian cancer, cervical cancer, and various miscellaneous cancers like vulval cancer, like that. So in this video we will have a first conceptual video, we will have a general basic knowledge. Second video will have a general basic knowledge on gynecological neoplasia, and then the videos will be there on specific disorders. So now let's talk about neoplasia. So neoplasia literally means there is a new growth. Neoplasia means new growth. So what is neoplasia? Neoplasia is an abnormal mass of tissue which is growing, which have a growth, the growth which exceeds the normal capacity even after stopping of the stimulus, growth stimulus. So we have a growth, but this growth is not normal. It is exceeding the capacity what the nature has decided to grow. There are some growth stimulus for every cell, but without any growth stimulus, the mass is growing like autonomically. So this is what the basic criteria for neoplasia. So what is a growth? The abnormal growth is autonomous. That growth does not need stimuli. It is excessive growth, not needed. That means we don't need this kind of growth for normal functioning of the organs, and it is again harmful to our health. So this is abnormal growth. Now neoplasia, basically we divide traditionally in literature we divide neoplasia into benign or malignant, but I will not go first with benign and malignant, because I think that the growth, the abnormal growth, there is a spectrum of abnormal growth, and then we divide them to benign and malignant. What causes what causes growth? That means what is a normal growth? What is normal growth? As we have know this thing, we as a human being or any animal start from the one cell, that is zygote. These zygotes keep dividing and making different and various too much cells. Okay, and then the one cell, there are making of millions of cells. Then that particular cell will differentiate into some functional cell, and then that cell will die after doing its function. This is what the normal growth pattern. So if we see, we have basically three germ layers. Everybody knows these three germ layers: ectoderm, mesoderm, and endoderm. There are various tissues that develop from the every layer. We will discuss it in very small quantity. Like ectoderm produces CNS, PNS, skin-like structures. Endoderm produces inner linings of lungs, guts, like that. Mesoderm produces skeleton. Mesoderm is the organ which produces most of the viscera and most of the we see what is a mass of our body, that is skeletal muscle, bone, connective tissue, viscera, blood, everything is made by mesoderm. So from where the germ cells are generated, germ cells which makes sperms and oocytes, they are produced from the ectoderm basically, but then they migrate to endoderm. Okay, As a gynecological concern, the uterus, cervix, vagina is made by the Mullerian duct, and from which layer Mullerian duct comes is a mesoderm, including the lining also. Most of the time, inner lining will be produced by endoderm, but as far as gynecology is concerned, our mucosas are produced by mesoderm. So the germ layers have a cells, the cell got division and going on, and lots of cell are produced. Now this cell, which have a capacity of dividing and producing new cells, now converts into a functional cell like this, having a basal layer, the central nuclei, the organelles, the shape of the needed function, that some organelles having increased or decreased according to the function they want. It is just like a baby. When you see a lots of babies of 1 year, mother and mother, so if you see the babies are same, all babies are same at the age of 1 year, but then they differentiate and become lawyers, doctors, engineers, movie artists. So they differentiate into their particular profession, and they differentiate. This is called differentiation. And once the cell is differentiated, it is very, very difficult to go back to what it was before. Like one person cannot just, once he become a lawyer, cannot just go to become a baby again. Okay, so this same thing happening is here. Once a cell is differentiated, get its functional properties, then that cell cannot easily go reverse back to the stage of division. Okay, so but once the cell is differentiated, just like neuron, muscle cells, bone cells, they become functional. They do their function. They get aged and they get die. So, what is the normal growth pattern decided by the nature? The new cell comes, it gets differentiated, it gets function, and it's die. But in neoplasia, there is a serious challenge against this natural growth pattern, this natural spectrum. Even stars in the sky, they also born, they also burn, and they again also die. Even stars, even every animal has a growth pattern like that only. But the neoplasia is a serious challenge against this spectrum. The cells don't die, they reverse the natural growth cycle. They again become undifferentiated. So the cell was differentiated and functional, but now this cell again go for undifferentiation. They got undifferentiation. They lose their function, or they do their abnormal function. They just lose their function. They just again become undifferentiated, and they start dividing and spreading and making the tumors. So neoplasia is what? Is a reversal of what is called natural growth spectrum, natural course of development. Now the functioning cell is doing its function, then it die. It die due to apoptosis or any physical injury. So if some injury is so serious to the cell actually cannot recover from the injury and cell dies. Many cells just die because doing their function, just like the cells of inner gut mucosa. Due to so much of function, they just keep dying and new cells coming. Some cells have a programmed cell that is apoptosis, which says that at some amount of time the cell should die. So the apoptosis thing is genetically determined death. Okay, but what happens in neoplasia? The cell here stop the course of dying. It just don't want to die. It again becomes non-functional and undifferentiation happens. And the cell becomes undifferentiated from very good functional cells to become just undifferentiated cell, which keeps dividing and keeping the growth. Any cell or any mass production need blood supply and nutrition. So any tumor or any carcinoma patient, the person gives history of weight loss. Weight loss is a very common symptom of any kind of tumor. Why? Because the nutritional pathway is now diverted to that growing neoplasia, which should not be growing, but now it's growing and it needs extra nutrition. So the person becomes generally weight loss. Every tumor is, first of all, it's benign, and then it converts into metastasis. Whether we know or not, every tumor is, and the first intense is a benign. What is metastasis? There's very simple difference: benign plus spread, that is metastasis. Now let's discuss some terminology we use while describing the tumors. So this is the normal structure of any body, our body, and this is conversion of this normal structure into neoplasia. So you can identify the difference between them. So there is a loss of basal polarity. What is basal polarity? That means that the nucleus, this is base, this is the base of the cell, and this is nucleus. The nucleus is synchronized with the basal layer. So the nucleus, the site of the nucleus is synchronized with the basal layer, but here there is a polarity, basal loss of basal polarity. That means the nucleus here are at same distance between those basal layer, but here you see nucleus can go anywhere. Now nucleus is not just located at where it should be. So this is called basal polarity, and it is lost in cancer. Then there comes the pleomorphism. What is pleomorphism? The variation in the sizes of the cell. You can see here the cells are almost equal size, but here the cells become very different size. So it is a pleomorphism. There is an increased NC ratio. What is NC ratio? It is a nuclear cytoplasmic ratio. That means nuclear size increasing in comparison to the increase in the size of the cell. So nuclear size is increased. You can see here nucleus size is increased. Here you see the nucleus, here see the nucleus, so much big. Okay, now comes the anisonucleosis. That means variation in the size of nucleus itself. So you see here every nucleus is almost same size. Okay, but now here you can see here different sizes are there. So anisonucleosis is, that means variation of the nucleus size. There is a hyperchromatism. That means nuclear chromatin is increased. So you see here chromatin structures are there. There is increased, like increase from here. So it is also a feature of neoplasia. Mitotic figures can be seen. What is mitotic figures? It can be seen in the normal dividing cell. Mitotic figures suggest the cell is undergoing a division. So again, I have already said neoplasia means division. So these mitotic figures, see here, this is mitotic figures. This kind of figure is a mitotic figure. That means that the cell is undergoing division. There are tumor giant cells seen here. The mucin is increased, DNA aneuploidy. That means the chromosome number is changed. It's not normal. It also changes. So these are the basic criteria or basic features of carcinoma and a tumor or a neoplasia. So now let's discuss the very old difference between benign and malignant tumors. So the benign tumors are encapsulated and well circumscribed, while the malignant cells are poorly circumscribed and irregular. The benign neoplasia compresses the surrounding tissue. Just compress. It's not invade, while the malignant cell invade the tissue. The size of the benign tumor is small, while always the malignant is higher size. Everything I have tell you that the basal polarity, pleomorph, basal polarity is retained in the benign tumor, while it is lost in malignant tumor. Pleomorphism is not present in basal in benign, but it present in malignant. Nucleocytoplasmic ratio is normal, here increased. Anisonucleocytosis is present only in metastatic tumors. So all these problems, all these basic things I have seen here is that benign tumor is just like a normal tissue, but the cell number is increased. Cell keeps dividing, that's why the number is increased. But in general, it just look like normal tissue. But once it convert into a metastatic tumor, a malignant tumor, then everything that I described, pleomorphism, NC ratio, anisonucleocytosis is increased. Okay? Metastasis is present in malignant kind of tumors. Now, if you see the gross appearance of benign and malignant, this is benign tumor and this is malignant tumor. So you see the tumor? This is basically the growing mass. It compresses the surrounding tissues, so make it just like capsule. It may not be the true capsule of this mass, but it compresses the surrounding tissue, and this surrounding compressed tissue just act like a capsule here. The skin you see here is intact because it does not invade. While you see here the malignant one, when the shape is just distorted, it's invading, its invasive growth is there. Inhomogeneous cut surface you can see here. Necrosis is there because it is rapidly dividing, and the center part of the tumor does not get blood supply it should be getting. So there is a necrosis in the center part, the hemorrhage because of invasion of the blood vessels itself. Vessel invasion here you can see here. Lymphatic invasion you can see here. Okay, so this was how a tumor looks, what is benign and what is malignant. Now let's go with some causing factors like genes. There are specifically 4 types of genes. Means growth promoter genes. We also call this pro-oncogenes. This growth promoter genes get activated and promoting the growth of the tumor. Growth suppressor genes, that is called anti-oncogenes. This gene should act when some cell is rapidly growing without control, but this genes got some mutation and they are now ineffective and they cannot suppress the growth, uncontrollable growth. So inactivation of growth suppressor gene is a reason for various tumors. There are apoptosis regulatory gene which also controls and programs a cell death, but due to some reason this apoptosis gene also get mutated, and now we don't have apoptosis and cell cannot die and cell will keep dividing. There is also various assembly of genes which is called DNA repair genes, which repair the injured DNA, but this repair gene sometimes gets mutated. So DNA is not repaired, there is loss of mutation, there is a various mutations, and then it comes the inactivation of needed genes. That's why the tumor happens. There are some oncogenes. What are the oncogenes? We call it oncogenes because they make the incidence of that cancer increased. So there are chemical oncogenes like benzodiazole, and all benzene derivatives, they are basically oncogenes. Smoking is an oncogen for lung cancer. Biological oncogens are also very important these days, because there are very discoveries of virus making all our tumors. So the virus, just like HPV, which causes the cervical cancer, can be the reason for metastasis or the tumors. Now, any tumor, our next thing comes to is doing the staging of the tumor. It's very important because your treatment and the prognosis will decide on the staging. Staging of the any tumor is done to document the severity of tumor and deciding the management, whether we go for surgery or not for surgery, or chemotherapy, or both, like that. What should be the treatment of the tumor? Surgical removal of a tumor is always considered a good choice. But sometimes the spread is so wide and unknown that we cannot just remove all the tumor alongside. So there is no advantage of doing surgery if we cannot remove all the tumor we can see. So it is a less benefit and more harm. So sometimes we don't do surgery. Those cases are now managed by chemotherapy and radiotherapy. What the radiotherapy and chemotherapy do? They just kill the rapidly dividing cell. They just attacked on the cell division factory. That's it. Now, for every tumor, we need to identify the risk factor associated with it, like age, exposures to some other carcinogen or factors, just like estrogen in our gynecological tumor, previous associated diseases, protecting factors also present. So we need to just see this thing also. Now when we call the prognosis of any tumor, there comes the survival rate. Generally we measure a survival rate of 5 years. That means if the 100 patient of some particular cancer is that of this stage, we have treated that stage cancer by our treatment, and now we are assessing what is up to our treatment is, then we need to go for a survival rate. For example, 80 patient is survived. So 100 upon 80, that means the 5-year survival rate. That means that 80 people survived at least 5 years. So the 5-year survival rate will be 80%. So it's a good treatment. Cancer, once a patient gets cancer, it's a very dangerous for it. The life and death is just like a synonym once the patient develops the cancer. So here we just have to expect the survival rate. We just cannot completely remove any tumor, or just like that. There are tumors which can be removed completely once and for all, but again we have a risk. So we just measure here 5-year survival rate. So this was all about basic criteria of neoplasia. In next video we will just discuss the basic thing, commoner thing of all the cancer we are going to learn in gynecology. Thank you, friends.